Hi, everybody. Dr. Joe here, and I just finished with a patient who was having issues in his upper back scapular area as a golfer. So if you play golf and you have some of the same issues, there's a few things I want you to take a look at and pay attention to. And once I share those with you, I'm also going to show you the exercises I gave him to see what you can do to correct those things. So to start with the presentation, his issue was top of the backswing, big full turn. He's having pain in his upper mid-back area, kind of right through here, just inside the shoulder blade. And that's a super common area for golfers to have pain. And I see it all the time, and they tend to present with a lot of the deficiencies that this client did. They may also describe that pain moves around a little bit, so it's not exactly in the same spot, which is actually very typical of the biomechanics in this situation, because it tends to be a problem with where you distribute that force, and where you distribute that force incorrectly can move a little bit. So, a few of the things you saw. So first, with his swing, he had a relatively low elbow on the takeaway, and he kind of rolled into external rotation, and instead of letting that arm come upward through here. And you see that a lot because typically people with this upper back pain or the scapular pain during the golf swing have a lack of external rotation. So they have trouble going this way. If you're checking this on yourself at home, you should at least be able to get to parallel if you want to make a good golf swing. To get in that position, you need to have mobility of the shoulder joint. You have to have proper length of your subscapularis muscle and your latissimus dorsi muscle. And if you don't have the mobility in those things, we may tend to make compensations. Another thing he didn't do very well was move his shoulder blades back and together. So if I'm here and I'm squeezing my shoulder blades together, I'm trying to create tension in the upper back, a stretch through the chest. If you have trouble with that, or it's really uncomfortable, or if you sit all day and you're in this rounded upper back position, that tends to be another exacerbating factor. We also look at rib flare. So most people who don't rotate well from the upper back will instead flare their ribs. So when they go into the swing, instead of rotating here, they're going to come up this way. So if you just put your hands on the front of your rib cage, if you feel like your ribs are kind of poking out into your hands pretty good, that probably tells me that you have been compensating with a rib flare frequently, and your body's kind of adapted to that posture, and you can feel those ribs poking out. Another thing, and really the last main thing, is overhead mobility. If you look at someone who takes their arms out to the front and goes up overhead, a lot of times you'll find one side more limited than the other. So you're looking at my right shoulder. This is really common in a right-handed golfer who struggles with this, where that right arm is just a little bit ahead of that left arm. It just shows a lack of overall shoulder mobility. So if you put all those things together, what you can't do is effectively position your elbow in the golf swing. So we've got to basically address all of those things. Now, some are more important than others. So with this particular client, I went focusing on two things. I focused on his stability and his ability to position his shoulder in end range. And a demo video of that's going to come on at the end of this video for you. And the other thing we focused on was the ability of the shoulder blades to move forward and backwards. Because in the golf swing, as we take a swing, on the trail side, that shoulder blade moves in toward our spine. This front side shoulder blade reaches out and forward. And then on the downswing, they switch. And that is what helps position the upper back. A lot of times I will also put in there something for thoracic mobility. In his case, I didn't today because I wanted to get him two exercises that he could get to real quickly, no body weight, and really take on the main issues I thought with him. But I'll add that thoracic mobility exercise to the end of this video for you. So if you have that pain and discomfort in the upper back, mid-back area, whether it's inside the shoulder blade, just below the shoulder blade, tends to be the same issues. And these exercises should help you solve them. You're going to need to do them a few times a day, maybe even for a week or so before you notice. In his case, what I did with him was also some dry needling. That really speeds up the process because it loosens those muscles up right away instead of taking time to do so. Obviously, you can't dry needle yourself without a professional, but you can use a lacrosse ball to do some massage and soft tissue work in that upper thoracic region, in the shoulder and the posterior rotator cuff, areas like that, which can help. So I hope this helps you solve your issues in the golf swing and with the pain in the upper back. If you have any questions, please leave them in the comments, and I'm happy to get to them. Thanks, and have a great day. We're going to do a movement called a serratus push-up, which is essentially a push-up where only your shoulder blades drive the movement. So I'll demonstrate this on the ground, but just so you can see, what's going to happen is my shoulder blades are going to come back, squeeze together, and I'm going to press forward. My shoulder blades are going to round outside along my rib cage, and then back, and then out. So it's going to look like this. Shoulder blades squeeze, drop down, press out. Drop down, press out. Now, if it's too difficult in that position, you can always take a bench, start at a little bit of an angle, and do the same thing. It's just going to make it a little bit easier if you use the bench. You can also do this leaning against the wall, which is going to make it another step easier. Book openers are a massive client favorite for thoracic mobility. You're going to lay down on your side. You want to bring your hips to a 90-degree angle, your knees to a 90-degree angle. Your hands you can drop out front. Head can relax on the ground, or if you want, you can put a pillow or a pad under there, whatever you're comfortable with. And then from there, you're going to take this arm, roll over and back as far as you can, hopefully trying to get that top shoulder to touch the ground. Take a big, deep breath. On the exhale, try and reach that shoulder all the way toward the ground, that little bit extra stretch, and then you'll come over top. If you're limited in room, you don't have to have the hands out. I just like it as a visual. You can have your hands close, and you can roll back this way and just focus the movement to your ribs and thoracic spine. Again, same inhale, exhale in that back position, and you'll come forward. So if you have limited area, that's a good one to work with. Perform scarecrows, you're going to start with a relatively light weight. I have a 5-pound weight here. Anywhere from 5 to 10 pounds is where I typically am with this. You can use plates, you can use small dumbbells, whatever your preference is fine. We're going to come to a 90-90 position, so 90 degrees at the shoulders, 90 degrees at the elbow. We're going to bring our arms up like we're a scarecrow and slowly control them coming back down. Slow and smooth motion. These are really a strong targeter of the rotator cuff muscles. If you have any discomfort or pinching in your shoulders, let me know so I can adjust this exercise for you.